Hi Pain Annihilators, this is Kelly from painandsimple.blog. Today I would like to talk about upper rib pain. You might call it upper back pain, lower neck pain, mid back pain, shoulder blade pain, the pain between your shoulder blade and your spine, a lot of different options. But if you have pain that's located right here along this region, then we're talking about the same area. I treat a lot of patients that come in with this problem, and this problem can be underlying and causing other issues such as shoulder impingement problems. So if you have shoulder pain, if you have upper to mid neck pain, but this is a secondary pain, addressing this area will greatly help with your other problem areas such as your shoulder and your neck. The ribs, I forget that the ribs go high up in the body. We think about our rib cage being down here, and this is our true rib cage, right? But our ribs go all the way up to the base of our neck. So our first rib starts as high as where my necklace line is. And as with any joint can have a moment of loss of mobility or joint play, or a muscle around that joint can be overworking or underactive or spasming, causing a restriction at that joint. So structure needs to equal mobility, and they are both counterintuitive to each other. So there are a couple of factors that can open you up to being more open to having this issue. So if you have a job that entails a lot of overhead lifting, a lot of hammering, a lot of cleaning or motion with your arm in front of your body over and over again, then you could easily become a victim of having this type of rib pain. If you like sleeping, if you're a side sleeper and you only sleep on one side repetitively, and you do not have a supportive pillow enough, then this could be a culprit as well. Also stomach sleepers as well that turn their head the same direction with their arm up over their head. This again can lead to a rib crick. I do have to remind everyone that the heart refers pain along the chest on the left side and down the arm, and also along that back area region where the pain that I'm talking about. So a heart attack pain is going to be a feeling of being restricted. It's more of a visceral pain, so it's a little bit more not as localized. It's more of a hazy feeling, and if that pain is very unusual and slowly worsening, you need to go see your physician or go to the emergency room as quickly as possible, specifically if it's on the left side, okay? The pain that I'm talking about is a pain that would be a very sharp, uncomfortable pain that you touch and you feel a knot along your back in between your shoulder blade and your spine. It's going to feel like a hard knot because that could be potentially your rib and the muscles spasming right underneath your fingertips. So I just want to clarify the importance of going to see your doctor or going to an emergency room immediately if you're having a diffuse restrictive pain along your chest or radiating along your backside. So today I'm going to teach you 4 techniques. Really, to be honest, 3 of these exercises are self-correction techniques, and 1 is a follow-up exercise. I recommend you doing these in the order that I'm going to instruct them on. This is something that I use personally for me and what I personally give my patients, so I hope it helps you. The second self-treatment technique is in the seated position as well, and you're going to have your hands in your lap and gently, so my shoulders like to hang down, so you're going to shrug your shoulder blades so they're even or at least horizontal with the floor, And then you're going to lightly retract or pull back your painful side. So I'm pulling back my left side. I'm keeping my left hand in my lat forward. I don't want to pull my arm back. So I'm doing a gentle scapular retraction or pulling back. I'm taking my non-painful hand behind my shoulder blade and I'm going to try to pull with my right hand forward. I'm trying to pull my shoulder blade forward, but I am not letting it. I'm doing a counter force back with my shoulder. So up, retract, hand placement, pull forward, and I'm holding 2, 3, 4, 5, and relax. And I will repeat that 5 times. You can rest for a few seconds in between the repetitions. Again, for the same, what I recommended the last time, if you're feeling like a sharp pain or unusual, or it's not helping, then go ahead and repeat this exercise. Go ahead and go up. And I want you to put your hand in front of your shoulder and then press in. Do that 5 times, holding for 5 seconds, and reassess. Like I said, you are just lightly tapping in and turning on the necessary muscles to help get them to turn off or to turn on to be more efficient, but ultimately to help with your pain. This third treatment technique is going to address the lower rib area because your ribs are all interconnected. There's fascia, there's skin, there's muscles, there's nerve endings that all share the same space. So we are going to address the lower rib area to help offload any stress or pressure that's occurring in the upper rib area, because you can think of this as a canister and it moves in conjunction with each other. It expands and compresses, well, at least the lungs do, and the ribs are interacting with those components as well. We have our powerful diaphragm that's lining our lower ribs. And so this treatment technique helps with 1, optimizing the placement of the diaphragm, 2, allowing for the fascia to be placed in an optimal placement, and 3, ultimately offloading this upper rib area. So what you're going to do is, hopefully you're flexible, your thumbs can stretch beyond your fingers. If you can't, the modified option is just go ahead and keep your thumb by your side if you're having any kind of pain in your thumb. If you do, look at my last post about texting thumb, because that's a helpful post about how to correct this thumb pain. Just a little tag there. But you're going to be addressing your painful side. So for me, it's still my left side. What I'm going to do is I'm going to, with my left arm, I'm going to hug my mid ribs. So I am taking the space between my index finger and my thumb and I'm placing it right where my bra strap would be. If you're a male, it'd be right on the bottom part of your chest. I'm going to hook in my hand in the space between 2 of my ribs. It can be whatever rib you choose. And you want to get into that muscle space, okay? So you're hooking up and you're gonna grip a little bit, and the motion's gonna be lifting up a little bit, lifting and twisting back. So you're lifting up and rotating back a little bit. So what I'm gonna do is I'm going to hook in, I'm raising my lower ribs up, and then I'm pulling back. I'm not twisting my torso, I'm only squeezing around my ribs and pulling my left rib cage back. While I'm sitting here, I'm gonna do 2 breaths through my nose and exhale through my mouth. And as I exhale, I'm twisting and pulling my elbow further back and my hand is moving further back. I'm gonna do a second breath, taking a deep breath in through my nose. And my ribs expand upward towards the ceiling. And then I'm going to exhale through my mouth. And that feels really good. If you don't have the thumb flexibility, you can always just use the base of your thumb to help cut into the ribs a little bit and then push back. If you don't have the flexibility of your shoulder, then just go ahead and just use kind of counter force a little bit and try to find a comfortable spot. You can also just do it with just your opposite hand too. It's not as effective, but you can do it. You can do this technique laying down as well. This last exercise, you will need a pillowcase. I have a huge gigantic king-size pillowcase. But you're going to take the pillowcase and fold it in half, fold it in a fourth, and then you're going to roll the pillowcase up into a nice little compact roll. You are going to stick the pillowcase along your shoulder blade, between your shoulder blade and your spine. So not too off to the side and not directly on your spine, but right in that middle part that was painful. And then you're going to lay on your back. And you can have a weight at home if you want, or you can just clasp your hands together, and you're going to raise your arms up over your head and then come back. So you're going to feel a little pressure into that pillowcase where your pain is, and come back. Just try to keep the front of your chest relaxed. Allow your shoulder blade to expand around the pillowcase. You have another option while you're in this position is you can do a little bridge as well to help apply a little self-mobilization, a little pressure into that pillowcase. And you can just do this about 10 times, holding for 3 seconds. I recommend doing this exercise on the floor, or you can do it on your bed if you like, but try to put a couple of towels down to make your bed a little bit more firm, because the bed might be too soft, because you really want to get that sucker and that area moving. Even just laying on the pillowcase on that painful side and just taking some deep breaths in and out with your hands on your chest is perfectly fine as well. I hope these 4 self-treatment techniques will help you get on the road to having less pain and feeling better with your life, with your job, with being at home. Please subscribe, hit the button below at painandsimple.blog. Also check out my blog online at painandsimple.blog. You can email me any questions at questions@painandsimple.blog. Thank you so much, Pain Annihilators. Have a good night.